think this is the one of the most important topics. Not only because I'm biased, of course, because I do sleep disorders and this is one of the things that I research on. But we know that there's a bidirectional association between neurodegeneration and sleep. And sleep could be the exposure, meaning it can come before a neurodegenerative process. It could be a biomarker where we know that certain sleep issues may allow us to know if there's a brain that is at risk or is vulnerable. And sleep can be the outcome, just a result of the neurodegeneration of the sleep-wake processes, along with with the other centers in the brain. And we know that a lot of the things that may happen during sleep or the lack of sleep may actually increase the amount of the proteins such as tau, beta amyloid, alpha-synuclein, which are all integral to neurodegenerative processes. Sleep is an integral part of proper brain health. We know this that people that have lack of sleep, of course, may have maybe a higher risk for neurodegenerative processes, and that also the neurodegeneration may lead to actually also poor sleep. And a lot of the efforts now are on see how sleep disorders and which sleep disorders may put people at risk for developing things like Alzheimer's disease or other type of dementias. The reason being is because we know there are not great treatments right now for dementias, and we think that there is going to, as the population ages, we know that there are going to be a high amount of people that will be going to be very old and at risk for developing one of these brain disorders. So if we're able to identify, for example, the things that the sleep disorders that may change trajectory, such as sleep apnea or insomnia symptoms or some other sleep issue that we can tackle very early on, even middle-aged, and improve it, maybe we can just change the trajectories of someone that is going downhill in terms of the cognitive function, cognitive aging, and their dementia risk, and really stabilize it very early on the process. And we think that we hope that we'll be able to do that quite soon. I think there's a lot of data now suggesting that a lot of the sleep disorders do lead or at least contribute to these aging processes and dementia risk. So it's a matter now of trying to develop some interesting and hopefully good intervention studies that will be able to show how the treatment of these disorders improve cognitive function and hopefully protect against dementia risk. We are actually looking right now at a study where is in the Hispanic community health study. The study is called Sleep in Neurocognitive Aging and Alzheimer's Research. And the idea is that we are able to study the risk of sleep apnea along with nocturnal hypertension and non-dipping of blood pressure, which is very common in people with sleep apnea, and see how these contribute to the risk of cognitive decline, mild cognitive impairment, and dementia risk. Emphasizing in a Hispanic Latino population, which tend to be underrepresented in these type of cognitive studies, and that we know have a high burden of dementia risk and also sleep disorders. And the idea is that we think that people with sleep apnea will have more of what is called vascular brain injury, and this could be in part because by the nocturnal hypertension or the non-dipping of blood pressure. And that's why we want to measure these two factors and see how they contribute and relate to the dementia risk. This is a lot of this work has been spearheaded by my colleague, Dr. Bryce McConnell over at the University of Colorado, where he has been able to do a lot of signal processing analysis of the EEG data during sleep. And with these, been able to obtain what is called slow oscillations and how these low oscillations associate with different type of spindles and what is called theta burst during sleep. And with these, then this decoupling or basically the timing of these different events during non-REM sleep have been associated not only with having proper, again, as you suggested, memory functions and circuitry, but then we also, through these processes and the decoupling and this, let's say, actually this entangling of these different processes, we're able to determine who could be potentially at risk for a neurodegenerative process. Maybe who will have higher levels of tau in the CSF or beta amyloid, and use this as another metric or another tool to identify at-risk participants and see what are the potential mechanisms that may put them at risk.